Thank you for volunteering to be a stem cell donor. This video is to give you information about the process of donating your stem cells through therapeutic apheresis services. Donation is always voluntary. However, if you withdraw consent after the patient has started their treatment, this will have an impact on them and they won't be able to continue their treatment. If you have doubts, please talk to your donor coordinator or medical professional as soon as possible. Stem cell donation allows medical professionals to treat patients with serious blood disorders and cancers. Stem cells are the body's master cells. They live mainly in the bone marrow, the soft tissue inside your bones, and they can grow into all the different types of blood cells your body needs. Red blood cells, which carry oxygen, white blood cells, which fight infection, and platelets, which help your blood to clot. For patients whose own bone marrow is damaged or diseased, a transplant of healthy stem cells from a donor like you can provide a potentially life-changing treatment for them. There are two main ways of donating: peripheral blood stem cell collection, PBSC, which is the most common, and bone marrow donation, which is sometimes preferred or medically required. While peripheral blood stem cell collection is the main method used in our service, you may hear about bone marrow donation, so it is important you know that this option exists. It will be discussed during your medical appointment. PBSC donation has two main stages: a medical assessment and preparation, and the mobilisation and collection of your stem cells. The first step is to attend the apheresis unit for your medical assessment. This can take up to 2 hours. You will be greeted by a specialist nurse who will check your identification, confirm your date of birth, and place a wristband on you. They will record your height, weight, blood pressure, heart rate, oxygen level, and temperature. You will be asked to complete a detailed health history questionnaire, including travel history. This is to make sure you are fit and healthy enough to donate. The nurse will then check your veins to see if they are suitable for the donation. During this appointment, we will take some blood samples. The medical team will explain more about this on the day. These tests are vital to ensure it's safe for both you and the patient to proceed with donation. If there is anything to be discussed about the blood results, the registry team will get in touch with you. It is very important to arrive well hydrated. We recommend drinking at least a litre of water before your appointment. This keeps your veins at their best, helps us take blood samples more easily, and prevents delays on donation day. Your veins will be assessed for suitability. The nurse may use an ultrasound scanner. In rare cases, if no suitable veins can be found, the medical team may recommend a temporary line called a central line. The procedure will be explained fully and your consent will be obtained. After your nurse assessment, you will meet with a member of the medical team. They will explain the donation process, go over the risks and benefits in detail, and check if you have any questions. You will then be asked to sign a few different consent forms to ensure you are happy to proceed with the donation process. They will also review your health history, carry out a physical examination, and arrange simple tests such as an ECG, a test that looks at the electrical activity of your heart. Occasionally, a chest X-ray may also be needed. These steps are to make sure donation is safe for you. Please avoid new tattoos, piercings, and any activity that may increase your risk of contracting an infection. It is important to note that if you are pregnant, you will not be able to donate. We also ask you not to become pregnant for at least 1 month after your donation. To prepare your body for donation, you will receive injections called GCSF. These move stem cells from your bone marrow into your bloodstream, ready for collection. You will need to take these injections for 4 days before your donation. You can choose to give the injections yourself after training or have a nurse visit you at home. Like all medicine, GCSF can cause side effects. The most common are flu-like symptoms, tiredness, headaches, and muscle or bone aches, often in the back, pelvis, or chest. They are usually mild and relieved with paracetamol. You may also notice mild redness or tingling at the injection site, or occasional nausea, night sweats, or difficulty sleeping. These usually settle within 48 hours of the last injection. There are some rare side effects. It is important you read the leaflet given to you before you take the GCSF. While taking GCSF, and for about 2 weeks afterwards, we recommend avoiding strenuous exercise and contact sports. On the 5th day, you will attend the collection centre. A nurse will place a sterile needle into a vein in each arm. Blood flows out through one arm into the apheresis machine, where stem cells are separated and collected into a bag. The rest of your blood is returned to you through the other arm. The collection usually takes about 4 to 5 hours. If enough stem cells aren't collected, you may be asked to return for a second day. This would involve more GCSF injections and a hotel stay. Stem cell collection is generally very safe, but like all procedures, it can have side effects. These will be discussed again on the day of your donation. The most common are nausea, tingling around your lips, nose and fingers, a metallic taste in your mouth, or a shaky, vibrating sensation. These are caused by the anticoagulant fluid we use to prevent your blood from clotting in the machine. This can naturally lower calcium levels in your blood. Let the nurse know if you feel any of these symptoms. They can manage them by slowing the procedure down and giving you some calcium in a drip. A small number of platelets can remain in the machine, which may lower your platelet count slightly. This is checked via a blood test before and after your collection. If your count is low, you may bruise more easily, which is why we ask you to avoid heavy lifting, aspirin and contact sports for 2 weeks following donation. Once we've collected your stem cells, the nurses will return the blood in the machine back to you. This is usually around a cupful. At the end of your donation, the sterile needles will be removed from your arms. The nursing team will check your blood pressure, pulse, oxygen levels and temperature, and make sure you feel well before you leave. Once the stem cells have been collected, they are counted in the stem cell laboratory. This can take up to a few hours. You will then be updated via telephone to let you know whether a second day of collection is required. During this time, you may choose to wait nearby at the hospital or return to your hotel until you are contacted. If a second day collection is needed, you will be informed and given clear instructions on what happens next. We look forward to seeing you at your medical appointment. Please don't forget to bring any questions you may have. Thank you for giving your time to help others in need.